Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Indications for the cholecystectomy in terms of the gallbladder polyp. So what are the features? That is, the indication is during all symptomatic patients. Second one is in terms of all asymptomatic patients as well. So symptomatic patients, everyone, and all asymptomatic patients, this is which is greater than 50 years. Next is in terms of the polyp size. So we are considering the polyp size of greater than 10 mm. So in case the polyp size is greater than that of 10 mm. And the last point will be in terms of the evidence. So in case of the evidence of the polyp growth. So there is evidence of the polyp growth, and this is on the serial ultrasonography. So now let's recap. So here we saw the indications for the cholecystectomy in gallbladder polyp. So the first point being in terms of all symptomatic patients. Second one is in terms of all asymptomatic patients, but the age is being considered that is greater than 50 years. Next is in terms of the polyp. Polyp means of the size of greater than 10 mm. Next is the evidence of the polyp growth. So there's evidence of polyp growth, and this is seen on the serial US, that is the ultrasonography. To learn and grow daily like this, please do subscribe.